Hello everyone, my name is Uliyemi Siwe. Today I will be talking about the article Applying Ethical Principles in Healthcare Practice by Kay Wheat, published in 2009 by the British Journal of Nursing. This article looks at how medical professionals make ethical choices while caring for their patients. The article focuses on five core principles: autonomy, fairness, justice, paternalism, and utilitarianism. These principles mostly influence the decision making process. However, they can contradict each other, which leads to complicated situations. For example, questions regarding how to strike a balance between accepting a patient's decision and knowing what's best for them, or how do we determine who receives life saving therapy when resources are limited. Now let's talk about key findings. The author highlights the challenges healthcare professionals face when these principles conflict with each other in real world situations. The battle of the principles. Stating the utilitarianism approach is a principle that focuses on helping most people, but it can sometimes feel unfair to those who don't benefit. Kind of like a trolley dilemma, sacrificing one to save many, or just pull the lever and let fate decide. On the other hand, there's autonomy versus paternalism, where patients should have the right to make their own choices, but sometimes doctors need to step in, which can cause conflict between what the doctor believes to be of the patient's best interest and what the patient wants. For example, a woman in labor experiencing complications and insisting on a vaginal birth instead of the recommendation of a C-section by doctors in a life-threatening situation. There's also justice and fairness. It's hard to make fair decisions about who gets care when resources like treatments are limited. These decisions often come down to tough, heart-wrenching choices that can leave a lasting impact on everyone involved. These findings show how ethical principles often conflict in practice and how they create real dilemmas. The article makes three main claims. One, do no harm. This is complicated because harm is subjective and can mean different things to different people, patients, and providers alike. Two, autonomy versus enterprise. While patient autonomy is important, it may conflict with healthcare professionals' judgment on what's best, raising questions like how much say should patients have regarding their care, especially in situations where their choices might be risky. Three, balancing principles is challenging. Fairness and autonomy often clash, making ethical decisions hard. For example, imagine a scenario in a busy hospital during a severe flu outbreak, one like maybe COVID. There's only one ventilator left and two patients needed. A young dad of three who has a good chance of recovery, and an elderly woman who has lived a long life but is very sick. Fairness says everyone deserves equal treatment, but only one can get the ventilator. These are the kind of decisions that healthcare professionals have to make under pressure, all affecting real people with real issues. In conclusion, regarding the application of ethical principles, there's no universal solution. No single ethical principle can solve all healthcare dilemmas. Doctors and nurses have to tailor these principles to each situation. They must understand how these principles work together and think critically because there's a lot at play here with life and death consequences when making these decisions. The article also talks about the challenges of balancing fairness, autonomy, and helping the most people. However, it's lacking as it doesn't present or suggest clear solutions for healthcare workers to follow in tough situations. Why does this matter? It matters because it helps healthcare workers make better choices that are fair, kind, and respectful to both individuals and the society. It also reminds us that ethical decisions requires compassion and awareness of how actions impact both the patient and the community. Thank you for listening. Have a wonderful day.